Contemporary issues in advancing practice. Clinical development, a contemporary issue. Since starting my journey within the nursing field, I have always aimed for further clinical opportunities that may have presented itself and fought for my progression in advancing practice. My end goal being to specialise in the clinical field and try to make a difference to patients' health and care. Initially, when I qualified as an adult nurse in 2015, it seemed very hard to progress towards this goal, as the environment at the time appeared to remain quite obstructive for opportunities for nurses to progress in their field clinically, whether that be relating to funding shortages, staffing or support shortages, or a reluctance for employers to support an advancing skill set to nurses. This resulted in colleagues and I self-funding university courses at times in order to progress and develop into a role which would later benefit the workforce that was initially so obstructive. Scenarios such as mine are not uncommon in present times, but the struggles experienced by nurses to progress clinically in advancing practice has been a long-time issue that dates to before the inception of the National Health Service in 1948. The National Health Service was created at a time when the Second World War had finished and the health needs of the population post-war were extreme, resulting in the innovation of a healthcare system for the whole population to access, not just those that could afford it. When looking at evidence even earlier than the National Health Service, the history of nursing advancement can date back to iconic figures such as Florence Nightingale, also known as the Lady with the Lamp, in the 1850s. Florence Nightingale's efforts to improve patient care during the Crimean War resulted in a fund being set up which was subsequently used to establish the Nightingale Training School at St Thomas's Hospital, London, in the 1860s. The Nightingale Training School was the first funded nursing training available within the UK, symbolising a significant chapter in nursing development and the foundation blocks leading to advancing practice in the nursing profession today. Within my current role in primary care, I have seen the recognition of advanced practice in this field becoming more substantiated as the growing GP crisis has been recognised, leading to desperate need for non-medical clinicians to aid in managing the patient load and delivering patient care where it is needed. The development of nurses clinically has largely been as a result of the changing needs of the population and the staffing shortages or medical shortages within the National Health Service that we have seen over the years. The British Medical Association has calculated that while other countries have more adequate medical cover relative to the patient population size, or an assumption of 3.7 doctors per 1,000 people, the UK falls significantly short of this and would need an additional 46,300 doctors to meet this estimated need for the population. In primary care between December 2016 and December 2021, there was a recorded reduction of over 1,500 general practitioners within the United Kingdom, recognising a further increase in patient burden to doctor ratio by 11%. The result of these significant reductions in doctors' numbers has contributed to the development of advancing practice for nurses in an attempt to bridge the gap for patient care. This is not to say that nurses in advanced practice roles are there to replace doctors, but within the advanced skills that nurses are able to obtain aids in supporting the clinical workforce inadequacies. A qualitative study related to the advancing clinical practitioners transforming the workforce in primary care confirms their positive contribution to meet patient care needs, but also recognises the need for advancing roles to be seen as more than a gap fill for healthcare and should be innovating the transformation of services on a wider scale. A report commissioned by Health Education England on advancing clinical practice in the UK identifies that appropriate nursing clinicians who have advanced practice skills that are distributed to services in need can help to improve the efficiency and effectiveness of services they are a part of. On reflection of my own personal experience so far through my nursing career and how this relates to advancing clinical practice, I am able to recognise many occasions of how advanced practice benefits services. An example of this was my time on a nurse-led unit which only had a doctor physically on the ward for 1 to 2 hours each week. This intermediate care facility progressed and developed its nurses clinically to meet the needs of the patients who were admitted and recognised that their health needs were increasing. Therefore, the needs for nurses with advanced clinical skills was established. The development of these roles in this setting was a success and resulted in these advanced nursing roles being embedded within the care model for these units. Health Education England defines advancing practice as advanced clinical practice is delivered by experienced registered health and care practitioners. It is a level of practice characterised by a high degree of autonomy and complex decision making. This is underpinned by a master's level award or equivalent that encompasses the 4 pillars of clinical practice: leadership and management, education and research, with demonstration of core capabilities and area-specific clinical competence. More specifically, in order to be considered an advanced practitioner, there are components set out by Health Education England that, from a clinical perspective, advanced clinicians should be able to initiate, evaluate and modify a range of interventions which may include prescribing medicines, therapies, lifestyle advice and care. Non-medical prescribing is now an imperative part of the clinical skills needed in advancing practice within the UK and is a mandatory part of the 3-year university degree for advanced practice. This skill was not always available for nurses to complete and began with recommendation from the Cumberledge Report in 1986, which recognised that patient treatment could be enhanced if nurses were able to prescribe from a limited list of items. It took more than 6 years for this recommendation to come to fruition, and appropriately trained community nurses were then able to prescribe from the extended formulary for nurse prescribers. Following these changes to legislation for nurses, there were multiple reviews and reports which penultimately led to the introduction of the Independent and Supplementary Prescribing V300, which now allows nurses to prescribe from the British National Formulary, if this is within their area of competency. Despite the clear recommendation of the benefits on advanced practice, including prescribing, there are still barriers and resistance from some medical colleagues who have not yet come to terms or do not understand the role of the advanced practice nurses. The 4 pillars of practice underpin all competencies regarding advanced practice and covers the area of clinical practice, facilitating learning, leadership, evidence, research and development. More specifically, in relation to nursing, the nurse who undertakes advanced practice is still registered and governed by the Nursing and Midwifery Council. The NMC Code of Conduct outlines the core principles and expectations of nurses in this profession, but has not yet generated a separate code specifically for advancing practice. On completion of additional competencies such as non-medical prescribing, the clinician is not able to begin prescribing until it is added to their registration within the Nursing and Midwifery Council, and then forms part of their revalidation requirements each 3 years. The NMC also encompasses the Royal Pharmaceutical Society's competency framework, which clinicians have to adhere to alongside the core NMC standards to remain a registered member. The opportunities for clinical advancement in nursing to master's level is becoming more and more prevalent, with a significant shift in perspectives and realisations of the potential for advanced practice within the healthcare system and how successful they can be. Unfortunately, despite this realisation by the healthcare system, advanced clinical practitioner still currently remains a title that is not yet registered with a professional body, therefore is currently not a legally protected title. For the most part, this title's lack of legal protection results in a feeling of risk for practitioners and can lead to a vulnerability for the advanced practice clinicians in potential circumstances regarding litigation. A survey conducted by the Health and Care Professionals Council identified within this survey this feeling of vulnerability or lack of protection was felt by many of the clinicians within the advanced practice field. Fortunately, in 2017, Health Education England produced a 23-page document on multi-professional framework for advanced practice in England, providing clarity on their role and accountability, which was previously unclear. The NHS 5-year forward view recognises that the NHS is in a stage of evolution, particularly within general practice, with a plan of multi-speciality community providers involving the encouragement of larger GP practices with specific services targeting patients with complex needs, including frail elderly patients and those with chronic conditions. The NHS 5-year forward view also states that Health Education England will aim to expand new health and care roles for a more flexible workforce, possibly relating to roles such as those in advanced practice. More specifically, within general practice, the General Practice Forward View recognises the benefits of advanced practitioners in general practice, and the Primary Care Workforce Commission report detailed recommendations to increase roles of advanced clinical practitioners within primary care as well as other professions. From a global context, advanced practice is recognised in most developed countries of the world with their own regulatory bodies and varying stages of recognition. A document generated for the purpose of a global united knowledge of advanced practice for nurses was generated by the International Council of Nurses in 2020 with a view of helping to shape policies and frameworks for advanced practice globally, whilst also trying to maintain a fluidity to ensure it is able to be used in various areas of the globe. When considering my current role and development and the studying I've undertaken to date, the following action plan has been generated, which involves completing the dissertation at level 7, resulting in a master's degree. Thank you for listening.